within reach, expanding access to safe abortion. Some of the most important decisions that women and couples make in their lifetimes are whether and when to have children. These are deeply personal decisions and also a universally recognized human right. In addition, for women, the timing and number of their births can greatly affect their health and that of their children. Women are able to become pregnant for about 30 years, but most only want a few children. So, it is not unusual for women to face a situation in which they are pregnant but cannot or don't want to carry the pregnancy to term. Around the world, unintended pregnancies are common. About 4 in 10 pregnancies worldwide are unintended, and more than half of these end in an induced abortion. Abortion is more common in some countries than others, but there is no country where it does not occur. Almost half of all induced abortions worldwide, 25 million each year, are carried out unsafely. That is, using an inappropriate method or by an untrained provider, or both. Unsafe abortion endangers women's health and lives. It is a leading cause of maternal death, accounting for about 1 in 7 deaths related to pregnancy and childbirth. And it is responsible for countless cases of illness and disability. Maternal death and disability are especially a problem in Africa, which has the highest rates of any world region.
As a midwife, I support access to safe abortion. We have had issues of sepsis among women who come late or just women who have had unsafe abortions. So I support this access because we want to prevent these issues of sepsis.
Je pense que l'accès à l'avortement sécurisé sera une bonne chose. Quand souvent les femmes n'ont pas accès à ces services dans nos centres, elles se tournent vers d'autres personnes qui ne sont pas habilitées à leur offrir ces services. Et c'est très souvent qu'elles nous reviennent, soit dans des états où elles ont des problèmes. Elles peuvent être stériles, elles peuvent aussi même mourir là-bas. Donc, c'est une bonne chose que cela soit ajouté au continuum de soins.
Countries in Africa can make changes to reduce death and disability due to unsafe abortion. To improve women's health, policymakers need to understand that making abortion illegal does not stop it from occurring, but it makes it less safe. Unsafe abortions incur high costs for women, their families, and health systems. And public health experts agree on what can be done to protect women's health. Let's look at the evidence. In Africa, more than 8 million abortions occur each year. This translates to an average of about 1 abortion per woman in her lifetime. Of course, not all women have an abortion, but it is likely that you know someone who has. A sister, cousin, friend, co-worker, or neighbor. Research has shown that abortion occurs among women and girls of all ages and socioeconomic backgrounds, rich and poor, whether they are married or unmarried, and whether or not they currently have children. There are many reasons a woman or girl might choose to end a pregnancy, such as worrying about finances, feeling that it's too soon to have a child, or not wanting to have any more children, stigma attached to having a child outside of marriage, health concern or risk to the woman, or when the pregnancy is as a result of rape or incest. Often women have nowhere to turn in these situations. More than 9 out of 10 African women of reproductive age live in countries with restrictive abortion laws. In 10 out of 54 African countries, abortion is not permitted for any reason. In 8 countries, it is permitted only to save a woman's life. In 32 countries, it is restricted to certain conditions such as saving the woman's life, preserving her physical or mental health, or in cases of rape, incest, or fetal abnormality. In 4 countries, Tunisia, Cape Verde, South Africa, and Zambia, abortion is broadly permitted. Yet, the legal status of abortion has little bearing on how frequently it occurs. Across Africa, between 30 and 40 abortions per 1,000 women occur each year, with little connection to the laws. In contrast, abortion rates are much lower in North America and parts of Europe, where abortion has been broadly permitted for 20 years or more. In these regions, modern contraception is widely available and used, which leads to fewer unexpected pregnancies. And in these regions, nearly all abortions, more than 9 in 10, are performed safely. In Africa, in contrast, only 1/4 on average are safe. Across Africa's sub-regions, 12% to 29% of procedures are safe, with the exception of Southern Africa, where 74% of abortions are safe. That region includes South Africa, one of the 4 countries where abortion is broadly permitted. The evidence shows that outlawing abortion does not stop it from occurring, it makes it less safe. And conversely, where abortion is legally permitted, it is not necessarily more frequent, but it is much safer. In South Africa, where abortion was legalized in 1996, the number of women who died due to abortion complications declined by 90%. Another example is Ethiopia, where the abortion law changed in 2005, expanding the conditions under which women may obtain an abortion, including for minors under age 18. Between 2008 and 2014, the share of abortions obtained safely in health facilities increased from about 1/4 to more than 1/2. In Ethiopia and elsewhere, much work remains to be done to ensure that all abortions are performed safely. When an abortion is performed according to World Health Organization guidelines, under the supervision or care of a trained health provider, and in a facility that meets minimum medical standards, major complications are extremely rare. In places where abortion is highly restricted, safe procedures are often only available to women living in urban areas who can afford to pay for a private doctor or who can gain access to abortion medication. Most other women do not have these options, making access to care extremely inequitable. Even in countries where the law allows abortion under certain circumstances, some women may have difficulty obtaining a safe legal procedure. Some policy restrictions limit where the procedures can be provided or who can provide them. Some healthcare professionals are uncertain about the laws or reluctant to offer services, and some women do not seek services because they are worried about stigma or being reported to the police. These kinds of barriers lead many women with unintended pregnancies to seek clandestine abortions, which are usually unsafe. These are often women who live in rural areas, are less educated, young, or unmarried. Young women in particular are more likely than older women to have an unsafe abortion because they may not know where to go, they may not be able to pay, or they worry about shame or embarrassment. Unsafe abortion methods may fail to terminate a pregnancy, and even worse, lead to serious medical complications, long-term disability, and even death of the woman. Beyond the risk to women's health and lives, unsafe abortion and its complications impose costs on families and healthcare systems that are already struggling financially. A study in 2012 found that each year, about 1.6 million women in Africa were treated for complications of unsafe abortion. The treatment is expensive because it requires skilled personnel, surgical procedures, drugs and supplies, and hospital stays. A study in Rwanda estimated the total cost to be $93 per patient, and in Uganda, $131 per patient. With so many women resorting to unsafe abortion, the costs for post-abortion care add up quickly, as much as $1.7 million in Rwanda and $13.9 million in Uganda. According to recent estimates, The cost of unsafe abortion in developing regions is 10 times the cost of providing safe abortion care. One of the most cost-effective ways to prevent unintended pregnancies and unsafe abortion is voluntary family planning. But it is underutilized in Africa, where nearly half of women who want to delay or stop childbearing are not using a modern contraceptive method. Meeting women's needs for contraception is a key strategy for reducing unintended pregnancies, unsafe abortions, and maternal deaths. Governments, donors, and health professionals throughout Africa have worked to expand women's and girls' access to effective and affordable reproductive health care, including family planning, labor and delivery care, postpartum care, and post-abortion care. Yet, a major gap remains in the continuum of care. Every year, at least 6 million women in Africa end their pregnancies unsafely. The consequences are dire. As many as 26,000 women and girls die each year from the complications of unsafely performed abortions. Evidence shows that policy change can make a difference to save lives and ensure that women and girls who need abortion have access to safe legal procedures. We need a commitment to women's and girls' reproductive health and rights at the highest levels of governments to translate international agreements into laws, policies, and actions, adopt and disseminate guidelines for providing safe abortion, and increase access to modern contraceptives. In various international agreements, including the 2030 Agenda for Sustainable Development, governments throughout Africa have committed to making sexual and reproductive health care accessible to all, and particularly to those who are most vulnerable to poor health. 51 African countries have signed the Maputo Protocol of 2003, a roadmap for guaranteeing women's rights and achieving universal access to sexual and reproductive health care. The protocol states that the signing countries should authorize medical abortion in cases of sexual assault, rape, incest, and where the continued pregnancy endangers the mental and physical health of the mother or the life of the mother or the fetus. Many African countries' laws are not in line with this commitment. Therefore, governments should revise abortion laws to give women and girls greater access to safe procedures, free from shame and stigma. Health ministries should ensure women have access to abortion in all circumstances allowed under existing laws. The African Union provides guidance that can help parliamentarians align their laws with the Maputo Protocol and help health ministries to interpret and implement existing abortion laws so that fewer women resort to clandestine and dangerous procedures. A second area of work is to adopt and disseminate guidelines for providing safe and comprehensive abortion services and to ensure providers have the skills, resources, and support to provide services safely. The World Health Organization has published evidence-based standards and guidelines for providing comprehensive abortion care, which have been adopted around the world. The most recent guidelines clarify that procedures in the first 3 months can be safely provided by non-physicians who are properly trained. One of these procedures is medication abortion. When women take oral pills to terminate a pregnancy, it is safe, cost-effective, and women can do it themselves with the right information on proper dosage. A third critical area of action is to promote widespread access to family planning information, counseling, and a full range of effective contraceptive methods to enable women to plan and space their pregnancies at a time that is right for them and their families. This is particularly important as African couples today want smaller families than their parents had. Women and girls everywhere want control over their bodies and their lives, and women and girls everywhere have unintended and unwanted pregnancies. It is tragic that women and girls in Africa and other developing countries die every day of causes that could be prevented with relatively simple technologies. Providers on the front lines have seen for themselves the results of clandestine and unsafe abortions and know that it is a very real problem.
When they are dying, that is when they run into the hospital, and then you try and save their life. But if our society can welcome the idea of save abortion, I think it will help us. Women, it will help us from dying.
Making abortion safe for all who need it is feasible, cost-effective, and compassionate. By ensuring that all women and couples can make a safe decision that prioritizes their health, family needs, and personal goals, we take a bold step forward in increasing equity and achieving African development goals.